Outstanding Service, Julie Ferry. Julie Ferry has faithfully served North Dakota in public health for 40 years. Julie began her public health career in 1983 at 1st District Health Unit. In 1985, Julie was hired as Administrator of Trail District Health Unit. In 1992, after her marriage and move to Dakota, Julie worked at Steele County Public Health before becoming Administrator of Nelson Griggs District Health Unit. She advocates for public health not only locally but nationally. She represents North Dakota at national conferences such as the National Association of County and City Health Officials.
When our statewide local public health team met initially, when the pandemic started, it was apparent that someone needed to facilitate the meetings. Julie stepped up right away, working closely with state partners to assure that everything that we needed was available, that information passed freely between local public health and the state health department. She facilitated our meetings twice weekly, and we were all able to be there and communicate well together. No one knew that that facilitation would last for 2 years, but Julie continued to facilitate until she retired. Julie is not afraid to speak up. She has great ideas and always stands up for public health. Her years of public health experience have been called upon many times over the past many years. She's always willing to mentor new public health employees or brainstorm with those of us who have been around for a while.
She has also served on numerous boards, including Tobacco Free North Dakota and the North Dakota State Association of County and City Health Officials.
If you know my mom, you know she's stubborn. You know she's hardworking, but above all else, she cares about people. Congratulations from your family. Dad, Christy, and I want to make sure that you know how proud we are of you.
During the COVID-19 pandemic, Julie's dedication and efforts were instrumental.
She does not take shortcuts. She maintains her professionalism and does not compromise at all on her public health principles. And so we always know that we're going to get the real deal with Julie. She's a strong public health advocate, and yet somehow she develops full-time to being a mom, a wife, a grandma. She loves being grandma. She has more energy than I can even imagine. She's cognizant of the needs of her community and is careful to pay attention to the opinions and actions of others and reflect on how they may impact us from a public health perspective.
Over the past 2 years, she has served as the chair for the North Dakota Public Health COVID response meetings. She has diligently ensured that critical updates are shared with the local public health agencies. These updates often serve as a lifeline during the ever-changing pandemic.
Julie Ferry is tenacious. She just tracks every single detail. She must have piles of notebooks somewhere in her home or office. Maybe she left them behind for people to look at, but I sure would like to look at some of those, I think. But she does look at those details, and then again, she works with Nelson Griggs or for the betterment of the state and make sure that everybody who can be involved is. I love to brainstorm with her because she comes up with new and unique ideas.
Julie serves as a mentor to individuals new to public health, co-chairs public health conferences, and represents local public health during legislative sessions and at national meetings. The citizens of Nelson and Griggs counties have seen an increase in vaccination rates because of her tireless efforts to educate the public in preventable diseases and bring vaccines to communities, schools, and businesses. Her devotion to tobacco prevention and control has resulted in implementing policies locally. She worked on the state's smoke-free law and continues to reinforce the law when necessary. Julie has also been instrumental in initiating and planning the biennial North Dakota Public Health Nursing Conference, which brings together public health nurses across the state to educate, develop skills, and promote networking.
It's hard to put into words what receiving the NDPHA Outstanding Service Award means. Little did I know when I started to enroll for classes at the University of North Dakota in the fall of 1977 that it would lead me to a career in public health and receiving an award for something that I love to do and have enjoyed doing it for the past 50 years. It has been an honor to serve the people that I've worked for in my service area. I want to thank Brenda Stallman for submitting my name to the awards committee, and thank the awards committee for selecting me for this year's outstanding recipient. You don't do this all by yourself, so a few other people include my staff at Nelson Griggs District Health Unit and all of my colleagues and friends that I have made over the years across North Dakota. Many of us are lifelong friends and will continue to do so. The other people that are in my life that I need to thank would include my family, and your kids always end up being part of the programs and services that you do. So to my son Sean and my daughter Christy, for all the things that you've helped with during my career, whether you were in high school or as an adult, I just want to say thank you. Lastly, I need to thank my husband. He's been my travel companion, he's been our doorman, he's been our office repairman, and he's provided all the love and support that gave me the time to do the traveling and attend meetings as necessary through public health, through my career. Thank you.